Hi everyone. This is going to be a guide to answering single best response SBR questions for medical trainees. What is a single best response SBR question? Single best response questions are clinical scenario based multiple choice questions where several options may appear correct. Your task is to select the most appropriate or best answer to fit the specific clinical context. Key features are a clinical vignette, 4 to 6 answer options, and it tests clinical reasoning rather than recall. Understanding the structure of an SBR question. An SBR question usually comprises of three parts: a clinical stem, lead-in question, and answer options. The clinical stem contains patient demographics, presenting complaint, relevant history and examination findings, investigations. The tip is to look for key diagnostic clues and red flags. The lead-in question tells you what is being asked. Common lead-ins are most likely diagnosis, most appropriate investigation, best initial management, next step in management, most likely complication. Always make sure to read this carefully before answering. Answer options. Usually, all are plausible options. They are often from the same category, for example, investigations or treatments. Your task is to choose the best option for this patient at this moment. The systematic approach to SBR questions. Step 1. Read the lead in first. This helps you focus on what is asked. Avoid being distracted by unnecessary information. For example, most appropriate next step in management. Now you know you're looking for immediate action and not a diagnosis. Step 2. Identify the clinical problem. Ask, what is the primary issue? Is this an emergency? Is this a diagnosis question, investigation question, or a management question? Step 3. Extract key clues. Look for age, timeline, risk factors, red flag symptoms, vital signs, specific lab results. An example for clues would be sudden chest pain with hypotension. Think of pulmonary embolism, aortic dissection, or tension pneumothorax. Fever with neck stiffness. Think meningitis. Step 4. Form a provisional answer before looking at options. This prevents being misled by distractors. Ask yourself, what would I do in a real clinical scenario? Step 5. Eliminate incorrect options. Use rule out strategy. Clearly wrong, not first line, not appropriate in this setting, contraindicated. Often you can eliminate 2 to 3 options quickly. Step 6. Choose the best answer. Between remaining options, ask, what is first line? What is most urgent? What is most definitive? Remember, the best answer is not the technically correct answer. For example, if you were asked regarding the next step in airway obstruction, CT scan is a correct investigation. However, the best answer would be airway management. Let's now look at common traps in SBR questions. The next step trap. Students often choose definitive investigation instead of initial management. For example, in a patient with suspected sepsis, the next step would be IV antibiotics, not simply blood cultures. The over investigation trap. Exam questions often prefer clinical diagnosis, bedside tests, first line imaging instead of advanced imaging. Ignoring patient stability. Always check ABCDE, the vital signs. If it's an unstable patient, you need to resuscitate first. The rare diagnosis trap. Exams usually test common conditions, classic presentations. Remember, common things are common. Other common pitfalls to avoid. Ignoring keywords. Look for words like most, least, next, or initial, which entirely changes the best answer. Not reading all options. Tempting distractors are placed early. Always read every choice. Overthinking. If the STEM provides a classic presentation, choose the classic answer, even if other options seem plausible in different scenarios. High yield exam strategy. Use the ABCDE approach. Many questions are solved by airway, breathing, circulation, disability, exposure, especially in emergency medicine and acute care questions. Think guidelines. Many SPR answers are based on NICE, ERC, WHO, and local emergency protocols. For example, anaphylaxis, think of IM adrenaline. Hypoglycemia, think of IV dextrose or IM glucagon. Identify question themes. Common exam topics include ACS, sepsis, stroke, trauma, electrolyte abnormalities, obstetric and pediatric emergencies. Time management in exams. First pass. Answer easy questions quickly. Second pass. Return to difficult ones. Avoid spending too much time on one question. For example, if a paper with 60 questions need to be answered in 3 hours, this will allow you to spend 3 minutes per question. Try to spend around 2 minutes per question on average. This will allow you time to return to the difficult or tricky questions as well as to recheck your answers. How to practice SPR questions effectively. Do question banks. Review explanations carefully. Identify patterns in mistakes. Study guidelines behind answers. Set a timer whenever you answer questions. And maintain an error logbook. Let's walk through an example SBR. A 65-year-old man presents with sudden onset right-sided weakness and slurred speech for 1 hour. Blood pressure is 150 over 90. CT brain shows no hemorrhage. What is the most appropriate next step in management? A. Aspirin. B. Thrombolysis. C. CT angiography. D. Heparin. E. MRI brain. Stepwise reasoning. This man presented with a sudden onset, right-sided weakness and slurred speech for 1 hour. Therefore, it's suspicious of an acute stroke. And since he presented within 1 hour, he is still within the thrombolysis window. And no hemorrhage on CT is suggestive of an acute ischemic stroke. Therefore, the best answer would be B, thrombolysis. Advanced techniques for high scores. Identify the exam level. Questions differ by medical student exams, PLAB, MRCP, MRCEM, etc. The management depth varies with each of these exams. Pattern recognition. Many exam questions repeat patterns. For example, a young woman presenting with pleuritic chest pain who is on oral contraceptive pills. Think of PE. Trigger words. Examples: sudden tearing chest pain, aortic dissection, worst ever headache, subarachnoid hemorrhage, painless jaundice, pancreatic cancer. Final exam tips. Read the questions carefully. Don't change your answers without a strong reason. Trust your first clinical impression and be mindful of the time. In our next video, we will talk about error logbooks. Don't forget to like, share, and subscribe.